The importance of nutrition and diet for good health. Eating well is important at any age, but even more critical for the elderly. Poor nutrition and malnutrition occurs in many older people, so it's important for home care aides to monitor their consumers' eating habits. Knowing some of the causes of poor nutrition can help home care aides become more aware of the possibility that their consumer is not getting their proper nutrition. Here are some of the causes. Decrease in sensitivity, a decline in the senses of smell and taste. Side effects of medication. This can lessen their appetite. Poor dental health can result in pain, not wanting to eat. Financial burden. Worry about expenses may cause them to cut back or buy less nutritious food to save money. Physical disability. Sometimes something as simple as opening a can may be frustrating, so they give up. Forgetfulness. Dementia or Alzheimer's patients may forget to eat. Depression. Depressed consumers lose their appetite quickly. Helping your consumer eat properly can start with the refrigerator and making sure it is stocked with the right foods. The right foods are nutritious, foods your consumer likes, and food your consumer is capable of swallowing safely.
Basically, I would tell any home care worker, that they should chat to the families about having, something from the 5 food groups in the refrigerators, such as dairy, fruits, vegetables, anything fresh if they could. Good products from the dairy family would be, of course, their milk, some yogurt, cheese, things like that, just to get their protein. Any fresh vegetables are excellent choices. Fruits, of course. We could keep in the cupboard your whole grains, such as whole wheat bread, pastas, things that can be assembled quickly for them, that they're not overwhelmed in food preparation.
Many of the elderly are on fixed incomes and may try to cut corners, sacrificing good nutrition in the process. Registered dietitian Stephanie Falvo offers some advice to help consumers eat nutritiously, even though some foods may be out of season and expensive.
Absolutely, especially when, we're out of season for some vegetables and fruits. We could always transition over to some frozen vegetables, which are great choices. They also have frozen fruits, which, mix well in a blender to make a smoothie with yogurt. The vegetables actually can be cooked in a lot of combination dishes with pasta to be, filling for the individual, yet more cost effective than, providing the fresh product. I would stay away from the highly processed foods. Highly processed meaning, canned items, a lot of cured meats, such as the lunch meats. I know they're a convenience, but for certain medical conditions, the salt content can really, cause a lot of other issues, such as if they're cardiac, get into, increased swelling. It's not good for the cardiac patient.
Canned soups and some canned vegetables can also contain high contents of sodium. Try to encourage frozen vegetables to replace canned and help them monitor the sodium content on the label. Stephanie offers some practical advice that helps your consumer make some gradual changes if needed.
Really, the biggest thing is making realistic goals for the patient, not doing everything all at once, just maybe minor modifications. If somebody usually drinks whole milk, maybe switch over to a super skim or a skim milk, 2%. Anything is better for calorie savings. If they're big soda drinkers or like a lot of candies and that nature, maybe we could switch from the soda to try, more water or a diet beverage, if that is something to conserve some calories. For salty snacks, a lot of people like to go for the salty snacks like crackers, chips. Maybe going over they have baked chips, they have crackers with less sodium, things. It's all in reading the food label, getting out there in the grocery stores and just educating yourself and, really making them have realistic goals.
Hydration is equally important in maintaining good health for your consumer. The elderly can become dehydrated very easily, and water is always the best option.
Signs and symptoms of dehydration, for the care worker to be aware of: poor skin turgor, sunken eyes, dry, cracked lips, dry mouth. Any of those things can really help prevent the patient from becoming dehydrated if we catch it quickly. pushing some PO fluids for them. It could really decrease the incidence of having to be hospitalized. We want to stay away from, a lot of juices because of the sugar content. Again, it's a concentrated sweet. Having your cup of juice in the morning, great, but throughout the day, best to drink some water, things that are decaffeinated. Also, if you're, a caffeine drinker, like with Coca-Cola or coffee, it's fine to drink those items, but we want to make sure that we're balancing it out with some water just to help to prevent, dehydration. Caffeine does, stimulate, the frequency of urination. It really can dehydrate you more than hydrate you.
Do not be alarmed if your consumer does not eat large amounts at a sitting. Many elderly consumers will be better with 5 or 6 small meals each day. Also, they may not need as many calories as someone who is more active, so don't be alarmed if your consumer does not clean his or her plate with each meal. Diabetics face special challenges, both physically and nutritionally. Being diabetic doesn't mean your consumer should give up all of the foods they love, but careful moderation is critical to their good health. The key is to find a good balance and make sure you are following the doctor's instructions. Here's a demonstration that is a good rule of thumb that all your consumers should follow, especially those with diabetes. Denise is a registered dietitian specializing in diabetic nutrition. She talks about a very simple system called the plate method.
Imagine having a dinner-sized plate, and you are going to divide that plate down the middle for one half of the plate, and then the other half is going to be divided in 2 other sections. On the side of the plate that has half of the plate, that's the side of the plate you would want to add vegetables that you like that do not make the blood sugar raise quickly. There are just a few that make it raise quickly, but most of them do not make it raise quickly. The few that make it raise quickly are things like lima beans and corn and peas. The vegetables that do not make your blood sugar rise can be steamed broccoli, cauliflower, carrots. You could put zucchini. You can have a nice cucumber, tomato, and lettuce salad. But the idea is to fill that whole side of that plate with non-starchy vegetables. Now, in the other 2 sections of the plate, you would want the one corner of the plate to have your round about 4 ounces of protein, which can be fish or a protein like chicken or meat. And the other side goes your starchy food. That can be your favorite little dish. A noodle, it shouldn't be really more than a half a cup or so. A half a cup, if you want to have a cup of that pasta, then push away the dinner roll, because you need a balance and you don't want to overload yourself with the starchy.
As a home care aide caring for consumers with diabetes, it is important to remember that there are 3 groups of foods that raise the glucose levels in your body the quickest. These food items need to be eaten in moderation. They are fruit and fruit juices, milk and yogurt, and starches. Starches include noodles, rice, a potato, biscuits, muffins, bread, and a little piece of pie.
I always get the question, about diabetic ice creams and yogurt. In my experience, just if we read the food label, the regular vanilla ice cream and the no sugar or the fat-free, sugar-free ice cream, they really have the same carb content as the regular. So what I would say to do is just have the smaller portion of the regular and be done. At least you get something that actually tastes good instead of it being heavily processed, because a lot of the diet items are really processed. They take things out and they need to put things in that makes them taste good to the consumer. So I would say portion control, stick with the regular and just a smaller amount.
There is nothing really that they cannot eat, even to the point of wanting to have that teaspoon of sugar in their tea. You have to count it. You have to count that sugar, that teaspoon of sugar, as a serving of a carbohydrate. Now we all know, the white foods such as the white flour, things made with white flour and the bread and the white sugars, they have little nutrition, but some people just want that little teaspoon of sugar in their tea. And, it's okay. It's okay. You want to have a little piece of that cake that, someone baked and brought to you. You can absolutely have a small slice of that cake. Absolutely.
Sometimes lack of good nutrition can be due to your consumer experiencing some form of depression. If you think depression may be a contributing factor, talk to them about it and alert your supervisor.
Depression can keep a person with diabetes, and even without diabetes, from getting up to, in a routine sort of way, get up at the same time or around the same time for breakfast, so that they're not laying in the bed or on a sofa or in their chair for a prolonged period of time.
Sometimes your consumer can't eat nutritiously because of experiencing difficulty with utensils. This could result from a stroke, rheumatoid arthritis, as well as dementia. There are many assistive devices that you can suggest to them to help make mealtime less challenging, such as a scoop dish. This dish makes it easier for a one-handed consumer to reach their food. Another useful tool is a plate guard that clamps onto the edge of the plate so that the food stays contained. There are a wide range of different eating utensils available if your consumer does not have good grip strength. If they don't have these useful tools, check with your home care agency. For those consumers experiencing financial difficulties, there are programs like Meals on Wheels or your local food banks that can help out with the cost. To summarize, there are many ways that home care aides can help their consumers eat well. Here's how you can encourage good eating habits. Make mealtime a pleasant and sociable experience by including the consumer in their food preparation. Give them a variety of healthy choices. Remember, the food presentation is important. The nicer it looks, the more inclined the consumer may be to eat it. Watch for changes in your consumer's ability to eat. For those that have trouble with grip, use assistive devices. For many consumers worried about money, there are many resources such as Meals on Wheels to help them. And it is important that they enjoy the foods that they eat. They should not deprive themselves of what they love as long as everything is in moderation. By doing so, your consumer has a much better chance of eating healthy, getting the nutrients they need, and still enjoying the foods they love.